Hi, I'm Patrick Pan. I'm class of 2024 and I go to Northridge High School in Tuscaloosa, Alabama.
Hi, I'm Jhelsy Cano. I go to Amphitheater High School and I'm the class of 2023.
Hello, my name is Patrick Pinder-Newton. I am a third year undergraduate student in mechanical engineering at the U of A.
Our lab mentor is Dr. Ladd, and our lab focuses on orthopedics.
The lab's main research question is, what is flatfoot? And we want to know how flatfoot develops.
The main reason why we want to answer that question is to know how flatfoot develops. We also want to figure out which ligament tears in which order causes the most severe flatfoot. And we would also like to figure out how to repair those ligament tears.
All of our testing happens in the MTS lab. MTS stands for Materials Testing System. We place the prep foot in the MTS machine on top of the sensor and apply an axial load onto the foot and the tendons to mimic a person standing on it.
We take pictures of the sensor on the computer and then Dr. Lack cuts a ligament. We do this multiple times until we cut all the ligaments we need to cut.
What I do to contribute in my lab is that we open the feet that we are experimenting on, then we expose the tendons, trying to get at the muscle as much as we can. Then we tie knots that we will eventually put weights on, and we pot the foot.
What I do to contribute to the lab is I partake in data analysis. We put all the data into an Excel spreadsheet and then we sort them.
So what I do specifically in the lab is I use the MTS machine. The MTS machine is basically like a hydraulic press. I don't know if you've seen those YouTube videos of them like crushing stuff, but that's basically what I use. And what we're doing exactly with the MTS machine is we're using it for axial compression, and axial compression is basically simulating the weight bearing load that someone has when they are on their foot.
So far during the data analysis, some trends that we have noticed are that the hind foot medial area of the foot, which is around your heel, the hind foot medial force, contact area, and contact pressure all decrease. So during our lab work, some personal questions came up. The personal questions that I had were, where do we get all the feet from? And do people get paid for donating feet?
My personal questions were if the results we are getting from the foot that are being transected to see how flatfoot develops are the same results that every other person gets. The other question was if it's ethical to do the research and experiments on the cadaver specimens, even if we did have the permission from the family or person.
Okay, one of the questions that, two questions that I had was, what is stopping ligament reconstruction from being viable? And since flatfoot is a degenerative disease, is there a way that we can strengthen ligaments?